Namaste. Welcome back to classes, Kaumarabhritya classes. So today we are going to deal with the next part of Navajata Shishu Paricharya. That is, in last video we discussed about the Navajata Shishu Paricharya, the first part, that is Jata Mata Shishu Paricharya. If anyone didn't go through the first video of Navajata Shishu Paricharya, anyone is seeing the Navajata Shishu Paricharya first video has this, you seeing the first video. Once you go through the back video, that is Jata Matra Sishu Paricharya, as we all got to know, Navajata Sishu Paricharya is divided into three forms, three stages, right? Jata Matra Sishu Paricharya, Sadhyojata Shishu Paricharya, and Navajata Sishu Paricharya. So in this video, we are going to discuss about the second point of Navajata Sishu Paricharya, that is Sadhyojata Sishu Paricharya. We'll move. So in last video, we saw Jata Matra Sishu Paricharya, right? Jata Matra Sishu Paricharya. Briefly, we'll go on discuss that what all we saw in Jata Matra Sishu Paricharya. That is first procedure. Jata Matra Sishu Paricharya is nothing but the baby from birth till cutting of umbilical cord is known as Jata Matra. The procedures followed in this time is Jata Matra Sishu Paricharya procedures, right? So what all we saw? First one is Prana Pratyagamana, right? And Prana Pratyagamana is nothing but the getting the baby's respiratory and cardiovascular system functioning in a accurate way. The next one is Ulba Shodhana, right? What is this Ulba Shodhana? Nothing but the Vernix case user removing of stickiness of a paste-like structure present on baby's body. Removing that is Ulba Shodhana. But nowadays they are not practicing this because it will prevent the baby from hypothermia. So just they are washing a baby or they are rubbing a baby with warm water. They are not removing this Ulba Shodhana. Next is Mukha Vishodhana. Right. What is the Mukha Vishodhana? Nothing but cleaning the airway of the baby. Maybe the mucus plug or the mucus present in a air passages, removing everything. In olden days, what they were doing, they were taking a swab on the finger, middle finger, and they were cleaning. But nowadays, according to new technology, what we are doing the gentle suctioning, right? That is Mukha Vishodhana. Then Garbhodaka Vamana. What is this Garbhodaka Vamana? Aspirated fluid with meconium or only fluid will be aspirated, whichever aspirated is present in baby's body will be removed out through Garbhodaka Vamana. In Grita and Saindava, they were mixing and they were licking a baby so that the baby was vomiting the aspirated fluid. But again, as new technology developed and they made the survey that it is creating a stress in newborn. So what they are doing now, they are not practicing this, but the using the catheters and suctioning tubes, we will suction all the aspirated fluid from the baby's body. Next one is Nabhi Nala Chedana Vidhi. So now what is this Nabi Nala Chedana Vidhi? This cutting of umbilical cord. For terms and for normal babies, we will wait for 1 minute and we will cut so that the whatever immunoglobulins are there from 100 to 150 ml blood, it will transfer from mother to baby. But in preterms or any complication babies, in low birth weight babies, we will cut immediately and we will take care of them for further steps, right? And how we will cut this umbilical cord? That is, they will, in olden days, they were taking Ardhadara Shastra and Karpasa Sutra, and the measurement also according to different acharyas, they gave different measurements, right? According to Acharya Charaka, he gave 8 angula. According to Ashtanga Sangraha, he gave 4 angulas. According to Ashtanga Hridaya, he gave 2 knots should be made and cut in between. Different acharyas gave different. And what they were doing, they were tying the thread to the umbilical cord and they were rolling to the baby's neck on in a loose pattern so that the bleeding or any infections will not cause. According to our model, what we are doing, we will cut with the forceps and we will give keep the cord clamped to the umbilical cord so that the prevention of bleeding will happen and the infection will not be present, right? So this was about the Jata Matra Sishu Paricharya. In modern, they explain newborn care, how we should care the newborn, like keeping the warm and breastfeeding and passing of urine and feces, maintaining of vitals. These all they explained. So this was about the Jata Matra Sishu Paricharya, which was detailedly explained in last video. So in today's video, we are going to discuss about the Sadhyojata Shishu Paricharya. So who is this Sadhyojata? Sadhyojata is nothing but the baby from time of birth for 24 hours. For 1 day, the baby is known as Sadhyojata Shishu. The procedures, whichever we will follow in these 24 hours, comes under Sadhyojata Shishu Paricharya. But remember one thing, if they ask Sadhyojata Sishu, then you have to write both, because from birth till 24 hours, the baby is known as Sadhyojata, right? So you have to explain the Jata Matra Sishu Paricharya and Sadhyojata Sishu Paricharya procedures. So if they ask Sadhyojata, explain Sadhyojata Sishu Paricharya, you have to write all this Jata Matra Sishu Paricharya 5 procedures. Then you have to continue the Sadhyojata Sishu Paricharya procedures, right? So what will be the procedures present in Sadhyojata Sishu Paricharya? That is Taila parisheka. First one is Taila parisheka and Snana. What the first procedure in Sadhyojata Sishu Paricharya? Nothing but Taila, Parisheka and Snana. The fetus has to undergo a lot of mechanical adjustment, stress, trauma, both intrauterine and intrapelvic from the time of labor, pain to the delivery, right? The not only fetus, even woman and fetus both will undergo many mechanical changes or mechanisms or many changes during this term, from the starting of contraction till delivery. Many changes will go on, right? There will be stress, maybe sometimes trauma, everything. So stress to the baby by his whole event is described in Ayurveda as prasuti klesha, which is vata predominant in condition. These all changes, what all happens, and the complications occurs. These all in our Ayurveda, it is explained under prasuti klesha, which is vata predominant. Vata dosha, as we know that we have 3 doshas in body, Vata, Pitta and Kapha. Vata dosha will be predominant or provoked in this condition. So to subside this, what we have to do? We can do Taila parisheka and Snana. Taila parisheka here is nothing but Abhyanga and Snana. We can consider Abhyanga and Snana. You can take any oil like Shirabala Taila or basic coconut oil. By heating indirectly, we can take and we can do Abhyanga for whole body of a baby, and we can do make them to have Snana. Here again, bathing is, these all are prevented or contraindicated in first day of life according to our new technology, because again they will say that the baby will go to hypothermia if you do all this on first day only. So obviously on first day they will avoid this, but before our acharyas, in acharyas days, it was practicing. Even in our ancient days also it was practicing, because at that time they were delivering in home only, right? They were not going for hospitals. Nowadays we will go for hospital and we will stay there till the doctors advise us to discharge. But before they were delivering in home only. Immediately after delivery they were doing all these procedures. But how they were preventing hypothermia at that time? They were using Udaka to prevent the hypothermia. But again, due to maybe contaminated condition, or maybe due to unhygienic, or maybe due to same, if they didn't use Ushnadaka, hot water, our babies were going towards the complications, somewhere having the diseases, all it was causing. So now they prevented. First day they will not go for Snana. Presently we will not go for Snana. This was explained in Acharya's days. And about Snana procedure, no need to explain, I think, right? Because you all will be knowing how they will bath a newborn. Even in our home, they will do all the abhyangas. These all paricharyas, even now we will practice, right? But on first day, we will not practice. After discharging from hospital, they will follow this even in our home. Snana or bathing is nothing but the normal temperature. In ancient days, to prevent hypothermia, they were using Ushnodaka, very hot water. But nowadays, as we are not doing Snana on first day, after baby getting stable only, we are going for Snana. So we can take normal temperature water, whichever will be comfortable or tolerable for the baby, and we can make the Snana. And in Snana also, particularly groin region or eye region, from medial to lateral we have to move, so that to prevent the infections, because from lateral if you move towards the medial, all infection will collect here, right? So you have to clean correctly from medial to lateral in every part, and you should clean all the parts of the body. And the baby should be dried by patting rather than rubbing with the towel. What our elders will do, they will rub gently. They will rub vigorously. The as baby skin will be sensitive, again rashes will start, or reddish discoloration of the skin will start. So you should not rub, just pat dry a baby, as baby skin will be sensitive. And main thing is the umbilical cord hygiene should be maintained, because the first 7 days are many very much curious to maintain this umbilical cord, because umbilical cord clamp will be present. That stump will fall down after 7 days. You have to maintain hygienic in umbilical cord region. And the rest all you can clean a baby pad dry, and you can wear a new dress. And another thing to add here is, before they were using powders, lot of powders to baby, but nowadays pediatricians are avoiding that. They are not saying not to use powders, because has baby skin folds will be present more. They will keep wrist like this, and they will be folding hands in these joints and all. By like this powder will go and accumulate there, it is causing infections. So nowadays doctors are saying not to use the powders after bath. And next one, this is about the Taila, parisheka and Snana. Next procedure is Pichudharana. What is this Pichudharana? Nothing but the Murda Taila. Obviously, the Murda Taila is used in Pichudharana. If Murda Taila is not present, you can go for normal coconut oil. What should be done here? The cotton swab is taken. The oil is heated indirectly. You can dip this cotton swab in oil and you can keep on the head of a baby. Especially where head of the baby means we will be having anterior fontanella and posterior fontanella to the babies, right? You might have seen. You have to keep on the anterior fontanella because one thing has the baby's vata kopa will be present. Vata dosha will be provoked. It will be subsided. And another thing is has the what is this anterior fontanella? Anterior fontanella is nothing but the joints of a bones will not be accumulated, right? So these Taila will make the joints to accumulate soon. Ossification of bones will become soon by keeping oil on anterior fontanellas. So they will follow this Pichudharana. And hence for the neonates is concerned, this procedure is helpful in reducing the prasuticlasia, especially that is related to Shiras. It also facilitates the cure of some birth injuries like Erb's palsy, brachial plexus. So though it is helpful in Vata Kopa, again it is helpful in some complications, right, like birth injuries like Erb's palsy maybe or brachial palsy. It will be helpful by doing this Pichudharana. The next procedure in Sadhyojata Shishu Paricharya is Udaka Kumba Sthapana. What is this Udaka Kumba Sthapana? Has according to our new technology, we have many options to maintain temperature, like maybe AC in summer or warm AC in winter. Many options we have, right? But in olden days, in our Acharya's days, they were not having any ways to maintain the temperature in a room. So what they were doing, they were following this procedure of Udaka Kumbha Sthapana in Sutika Gara to maintain the temperature of a room. In warm, like in summer, they were using cold water, and in winter they were using warm water. The procedure is take a mud pot, fill a water in it, like vice versa according to season, and keep it near the head of a baby or near the cot of a baby to maintain the temperature of a room. This is nothing but Udaka Kumbha Sthapana. And last procedure of Sadhyojata Shishu Paricharya is Prashana. Prashana here nothing but licking of semi-solid by the single finger of a attender. You can lick the baby by dipping in a semi-solid one. What is the semi-solid? Maybe the honey and grutha or maybe any media drugs in semi-solid form we can use. But here coming for Sadhyojata Shishu Paricharya Prashana on first day, that is nothing but the Jata Matra sorry, Jata Karma Sanskara. That is nothing but licking the Madhu and Grutta with combination of Swarna, pinch of Swarna in it. We will dip our finger in it and we will make the baby to lick. This is the Prashana of first day. But according to Acharyas, this Prashana is explained of 4 days. Only first day will come under Sadhyojata Shishu Paricharya. Next 3 days will come under Navajata Shishu Paricharya. With detailedly will I'll explain in that Navajata Shishu Paricharya in next video. But on first day, why we are doing this? Obviously, now according to new like technologies or pediatrician will avoid this. So they will say it is not good for baby to lick. But according to our acharyas, has Grutta and Madhu combination not in equal quantity, because if Madhu and Grutta, if we take in equal quantity, it will become Viruddha Ahara. We are taking unequal quantity of Madhu and Grutta. We are making the baby to lick it. It will stimulate the gastrointestinal nerve plexus so that the baby will pass the meconium as soon as possible by licking this. So our acharyas, by keeping this view in mind, our acharyas explained to give madhu and ghrita in unequal quantity and make the baby to lick on first day immediately after birth, so that the baby will pass the meconium as soon as possible. So this was about the Sadhyojata Shishu Paricharya. Sadhyojata Shishu is nothing but the baby from birth till 24 hours. The baby is known as Sadhyojata Shishu Paricharya. The procedures comes under Sadhyojata Shishu Paricharya is from Jatamatra Shishu Paricharya, that is Prana Pratyagamana, Ulba Shodhana, Mukha Vishodhana, Garbhodakavamana, Nabhinala Chedana. Including these, the other procedures like Taila, parisheka and Snana, Pichudharana, Udaka, Kumba, Sthapana and Prashana. These all 4 procedures are extra added in Sadhyojata Shishu Paricharya. So in next class, we'll move towards the Navajata Shishu Paricharya procedures. So this was about the Sadhyojata Shishu Paricharya. In next video, I'll explain about the next topic, that is Navajata Shishu Paricharya. So that we'll complete whole Navajata Shishu Paricharya in 3 parts. Thank you.